Hi, I'm Emlyn. I'm the IMAP DRR lead and the manager for the Afghanistan Spatial Data Center. Many information management organizations, we receive data from humanitarian agencies, we clean it up, we analyze it, and then we map it and make reports out of it and we send it back. Unfortunately, in many of the countries where we operate, much of this data is, well, there's hardly any accurate data coming out from the field because we're outsourcing a lot of stuff. So if we look at emergency response in Afghanistan, if, let's say, a flood happens, the UN set out in their vehicles and they can't even find the village. They have no idea if that village has mobile phone coverage, how many people that are living there, how many people are at flood risk, what's the nearest hospital or airport. That's elementary information which you need to solve because currently your staff is going out completely blind. So we've solved this as best as we could. So our program is focused on DRR, forecasting, planning, and emergency management, and monitoring and evaluation. Many of the NGOs, they work within specific districts or provinces, sometimes a few dozen or hundreds of villages. With information, you can look at the national scale. That's quite easy. Data is manageable. The UN and the government mostly have statistics available at the provincial or district level. Population data is only available until now at the district level. And we've modeled that down to the village level. All our data is modeled down to the village level, and that's quite nifty. You need this to make good products. So what do we provide? We provide maps, statistics, and nice little infographics which people can include in their reports. And we look at some of the traditional DRR components such as floods, avalanches, earthquakes, but all of that information is only relevant if it actually affects people or hospitals or other infrastructure. If floods occur in the middle of the desert and there's nobody living there, it's of no consequence. And if something happens, how do you get there? What is your travel time? So we've calculated the travel time between each village and the nearest airport, nearest small or larger hospital. Do you have mobile phone coverage? And unfortunately, we also had to model all the security incidents. IMAP has mapped 135,000 security incidents, humanitarian access incidents since 2008. Kidnappings, landmine explosions, how many people have been killed? This is relevant if you are working in the field. Quick focus on natural disasters. So we have static flood risk and avalanche risk. We've modeled it. It's so far the best available data sets in Afghanistan. And we have earthquake risk that comes from USGS. So that's static risk is perfect for planning, monitoring, and evaluation. Now, forecasting, every hour we monitor the flash floods, and that's valid for the next 6 hours. We monitor river floods every 6 hours for the next 4 days. Snow cover depth and coverage once a day, same with avalanche risk. And after a heavy earthquake, we monitor it every 5 minutes, and approximately 1.5 hours after a big earthquake event, we can tell you which areas have been affected more and how much people are living there. That's practical if you have to send out your helicopters. Whatever. So we disseminate this information through the ASDC. It's a GeoNode on steroids, actually. Our developer is very proud of it. And on the surface, it's like a traditional GeoNode. We have static maps. We have more than 2,000 maps online. It's the largest catalog for Afghanistan. We provide interactive maps, and that's a powerhouse where you have your traditional layers, which you can switch on and off, satellite imagery. But we also have tools that help you to find settlements and locations. And the real power lies within the statistics tool. You select a province or a district, you draw your own little polygon, and within that region, we give you all the information and data which we have. We can tell you for a specific area, there's 25 hospitals, there's 5,000 people living there, there's this many kilometers of roads in these categories. Information, if you're in the country, if you ask the Ministry of Public Health, they can't tell you how many hospitals they have in a specific province. 1 minute?
No, that was the minute.
Okay.
The first one. But go ahead, finish the last couple of words.
Last component, because not everybody can work with interactive maps, we have a dashboard for the high-level people. You can integrate this type of data in your own reports, so that's kind of nifty and quick. And last point, this is a tool. I think people always forget in the information management community, it's not about the tools, it's about the data. And so that's it from my side. Thanks.
Okay. A second person, Franklin Galea.
So, hello everyone. My name is Franklin Galea. I work with UNHCR in the WASH unit. Please bear with me. My presentation is definitely not as beautiful and good looking as Emily's presentation. I'm going to talk about WASH CAP surveys and how we try to standardize them in the humanitarian world and especially in refugee context. And I'll try to bring some links to mapping, as it may not be obvious from the onset. So CAP surveys, CAP stands for knowledge, attitude, and practice. They're household surveys that we try to do on a yearly basis in refugee camps or refugee sites to get an idea of what are the household indicators, what kind of service our people of concern are getting at the household level. The problem we have with this at the moment is that those surveys are done in a very inconsistent manner. Sorry about that. They're done in a very inconsistent manner. For example, I've compared 24 different surveys that have been done by different partners in different places, different years, and found that not 2 of them were consistent in terms of information collected or sampling methodology. So there is a need in the sector to standardize those CAP surveys. And in a joint venture with CartONG, we've been working on such a tool that would include a standard questionnaire, a manual to guide the people that would use it, an automated analysis tool, and also a lot of supporting documentation, especially regarding mobile data collection. The different opportunities and benefits of such a survey is that, well, I guess the main aim is to have consistent data over time in the same place and also over space. Data that we can compare and see how is the situation better, has it worsened, why, and it will help us in the programming of our activities. And we want to store that, of course, online to be accessible for everyone. Other opportunities, we want to make sure that we want to guide people who use that tool, make sure that the data they collect is accurate and representative of the camp or of the site where the survey is being done. Some of you might be familiar with sampling. It's not that easy to as something to grasp. So we're trying to help people provide consistent data and most important of all, representative data, so data of quality. We are pushing with CartONG towards the use of mobile data collection, which really simplifies the process and also can provide some automated analysis, which also really helps you save time, save resources in the field. Of course, this then will be made accessible to everyone. So, I don't know, agencies in the field who do not feel too comfortable with WASH CAP surveys can use that tool, and it will help them put in place such surveys on a yearly basis. And of course, I've put this under opportunity, but it is a challenge as well, is the possibility to adapt to the context. Because it's difficult to have one size fits all. So we made sure that the survey can be adapted to different contexts, but that is definitely a big challenge because in terms of adapting the questionnaire, in terms of mobile data collection, there are a lot of things we need to think about. When you change a question, it changes maybe the way you calculate an indicator, it changes the analysis of your data. So it's really a lot of things we need to think about. Another opportunity that is linked to mapping is that we can use, when using mobile data collection, we can capture GPS points of the different households, and at camp level, we can map the different levels of services. So it's easy to say, okay, this part of the camp is getting less water than this one, why is that? And then we can bring some corrective actions. I'll quickly go through the challenges. Challenges are, of course, get everyone to agree. There are so many different agencies, partners working in the field. It's difficult to get everyone to agree on a questionnaire or so. It's been a very long process. We're getting to the end now, but that has been pretty challenging. The sampling methodology is dependent on the context. Do we know how many households are in the camp? Do we know the address of every household? Is different. Then you can do some simple random sampling. If you don't know anything, you have to do cluster sampling. So there are some things that can't be standardized. And there is an interesting relation with mapping, is that if we have the map of the camp, a recent map up to date of the camp, and we know where all the households are, then we can give them a number and do some simple random sampling. And of course, it's quite big work to improve mobile data collection capacity of partners.
Okay.
So quickly, this package will be rolled out before the end of the year. And from next year and beyond, we're going to work on improving it. Thank you.
Okay. If everything is working technically, Roxanne, I believe you're next. They put the things in the right order.
Cool. Hi there. I'm here to talk to you a little bit about Service Advisor. And this is an app being brought to you. My name's Roxanne, and being brought to you by Peace Geeks. So to start off, this quote comes from the WHS, Middle East and Northern Africa report. It says, humanitarian organizations need to provide information about their services because it's not humane to respond to refugee information needs with "I don't know." And this highlights the idea of a service information gap, where there's service providers giving access to refugees and enabling access to health, education. And the refugees need to know that information. But sometimes we don't always communicate that in the best way possible. And so that's what this helps to try to work at. And it's essentially a vital app that connects refugees to essential information on all humanitarian services. So this is the pilot study from Jordan. And essentially, it maps out, based upon a category, food, health, basic needs, the region, what type of nationality, if there's any inclusion criteria, like you need to be a youth, you need to be a female, you need to be of a certain nationality. And we'll help you figure out where to go to find access to those services. I showed you originally the web application, but this is also a mobile application as well. And essentially this database and this app has been developed to help with the assistance and by a number of refugees that were consulted to figure out what do they really need in order to help them get access to the most important information for them. Behind the scenes, so that's the public facing for any of the refugees who are trying to find access to this information. Behind the scenes, it's a database, it's an admin panel. It's primarily focused on making it really, really easy for service providers to input this information and keep it up to date. because some of the challenges, as already highlighted, people are moving constantly. Points of contacts are moving, agencies are moving, and so keeping track of this information is relatively difficult. And so the features, overall, you can search by organization, referrals, language. Language is a big thing right now. It's in English and Arabic. It's being expanded to Farsi, and then 2 other languages. My apologies, I'm blanking right now. And allows you to understand where these people are, and then start to analyze who is leveraging and who's trying to gain access. So for example, if everybody's looking for health in a given location, well, maybe we should start sending more service providers in that area. And as mentioned, it's geared towards refugees, to the service providers, and also for coordination. That idea of analytics behind the scenes and helping us ensure that the information and the services required are in the locations necessary. And so it was originally pilot tested in Jordan. It's now being expanded to Turkey as well as Somalia. And sort of to wrap up, Syria is the biggest humanitarian and refugee crisis of our time, a continuing cause of suffering for millions who should be garnering a groundswell of support around the world. So there's lots of need, and there's lots of people right now who are moving globally. And anything that we can do to help ensure that all the persons trying to help, trying to gain access, have access to information, that's what they're trying to work on. So thank you guys so much. This is Peace Geeks. The woman in charge of this program, her name is Renee, and she's really remarkable, and I encourage you to reach out to her. Thank you.
Thank you, Roxanne. I think there's a record that needs to be broken, finished in record time. Okay, next is Edmund Bach. And you can introduce yourself. Pete, I'll let you go last because, okay, because the presentations are...
Hello, everybody. My name is Edmond Var. I'm working as an information management advisor within Terre des Hommes. I'm based in Lausanne. And I will present you a project which is called YEDA. The objective of YEDA is, no, not the objective, but the situation that we are where we are implementing YEDA is in the Sahel area. We have around 10% of children which are dying before the age of 5. And the reason why these children are dying is mostly due to simple due to pathologies that could be simply treated, like diarrhea, malaria, pneumonia, these kind of things. Some of the reasons that were identified why there is so many children which are dying with this simple disease, it's because we have a low quality of care in primary health center within Burkina Faso. This is due to several reasons, but some of them are inadequate staff supervision, so that means there is no proper management of staff, and health workers are not enough trained also, and there is no proper data management, so to support the, that's the right way, the supervision. The consequence of that is that you have a high child mortality and morbidity. I'm moving too fast. So therefore, the objective of the YEDA project is to ensure that children which are entering in primary health center have a proper diagnosis and receive a proper treatment. So for the moment, it's a project which is implemented in Burkina Faso. We are extending it will be extended in Mali soon. We are working in 3 health districts. We are working in more than 400 health centers too. There is 4 components, and that means there is more or less 4 hubs behind the whole project. So one is dedicated to improve the diagnostic. So that means to try to automatize, not to automatize, but yeah, to improve the quality of the diagnostic. So to reduce classification issue and prescription error. We have also an app which is dedicated to the data analysis. The idea is still to be able to spot where we are doing some error, where the health worker is doing same time the same errors, these kind of things. You have an app which is dedicated to the coaching in order to support the supervision of the different health worker. And the last one, which is dedicated to the e-learning. So the idea is that all of these 4 modules are working together, and if we see that one health worker is doing every time the same error, we can provide him with e-learning. Which kind of protocol are we digitalize? The idea is to digitalize a protocol which is called Integrated Management of Childhood Illness. It's more or less a handbook of 200 pages that normally a health worker is supposed to use when he is working in the health center. So it's something which is very complicated, and it's the different steps that a health worker is supposed to follow when a child between 0 and 5 is entering in the health center. And behind, I will not go into detail, but behind this this protocol, you have an algorithm or a decision tree which lead to a decision. So if there is an urgent need, or if it's something which could be treated simply, yeah, that. So I just show one of the applications. So I didn't show the four applications. So this is the main one, which is dedicated to the automatization of the diagnostics. So it's based on CommCare technology, and it's work on tablet. It work with wire. Yeah, it's work offline, but for the synchronization of data, it's work only with 2G. And of course, everything after is based on the cloud application, so we need to synchronize. But the idea is that the four application can work in offline context, and so that means in every health centers in Burkina Faso. There is different partners which are involved in this project. So Terrorism is in the coordination. We are working very closely with the Ministry of Health. Dimagi, which is a provider of CommCare, is our technical partner. But we are also working quite closely with the London School of Hygiene and Tropical Medicine for the evaluation of this project. And we are doing some random control trial. So just to give you perhaps the first results that we get. So now it's a very long project, but we are at the second year of implementation. And if I focus just on two figures, we see that now we have 65% of children which are correctly evaluated, and we receive a coherent prescription. So that means we are still far from our target. But in comparison with the control area, it's still, there is still improvement, and we see that our project are reaching our objective. What are our main challenges? There is medical challenges. It's due to the limitation of the handbook that I showed you before, because it's an old handbook, and now there is a limitation of the medical criteria of this one, and it's need to be redesigned. Of course, the infrastructure issue, we are struggling with connectivity, even if it's working offline. Sometimes we can have a health center, we cannot be synchronized for several weeks. We are trying to work on improving the supervision and management. So the idea is to create a data culture within the different districts, within the Ministry of Health, in order to support them, in order to be able to use more properly the data that has been created by the different applications. And we are also working on integrating this tool into the health information system. And just to quickly, our perspective is to integrate more protocols, so such as for the nutrition, prenatal, to implement the project in other countries with other partners. That's it.
Because the audio-visual presentations have a certain order, we're going to jump, and Neil Penman presented discussion. No. They misunderstood. I guess. Okay.
Oh, it is me.
Okay.
Okay. Yes, I'm Neil Penman from SMAP Consulting, and the title is putting the A for accountability back into meals. And that's a big statement, actually. So what we're really looking at, and I'm working with Amos Dornbos from World Vision on this project, what we're really looking at is improving the way we do feedback within World Vision. So really what I'm going to say today is that to help improve the management of the accountability process, we're going to use standard mode. We're going to use standard mobile data collection tools to get the feedback. But the plan is, and it's an ongoing software development project, customization. The plan is to add a second oversight form. So very similar to the first form, or you can create it any way you like. And that is going to allow you to modify and annotate the feedback that you've received in your from the field, from the phone. If you like, in terms of a process, this second form, the questions in it contain the state of a process. So things like who the feedback is assigned to, what its priorities, and so on. So Amos can't be here today. He was going to be here, so I'm just going to speak his words. He's the Disaster Management Strategy and Systems Director for World Vision International, based in London. And he's going to talk about why we are doing this. So feedback is important. Understanding what communities think about our projects, what's working and what's not, as well as engaging communities to shape how we respond, is critical to our humanitarian responses. For this reason, we intentionally seek feedback and establish a complaints mechanism in all of our responses. Paper's bad. And we know all about this from mobile data collection. For years, it's been done on paper, this feedback. Paper gets lost, paper gets wet, it's heavy, it's hard to move around. So at one point, they decided they had enough and decided to go digital and built a MS-Access, locally accessed system in one national office. And they say that it was painful. That was really more about being on a laptop in a national office rather than MS-Access, although MS-Access has its issues. So we decided that form-based data collection is a good start. And they talked to me at SMAP. Everything that Amos said previously about problems with paper applies to monitoring and evaluation as well. But it's been, to some extent, solved through mobile data collection. So we can do the feedback on a smartphone, tablet, laptop in the community, or through helplines. All the data is easily centralized, consolidated, and tracked. Some fairly mature technology. So things we learnt, they want to know the person giving feedback. They want to know if the person complaining is a beneficiary or not. And you can ask me questions later about this, because technically there's some issues with implementing that, mainly around privacy. Want to protect sensitive data, but also provide a response to the person who made the complaint. So you need to know who they are. So that's very sensitive data. So they want to scrub, some situations scrub the beneficiary data from the complaint, but at the same time reply to them. Again, ask me questions about that. That's not trivial stuff. Multi-channels, and again, the mobile data collection helps provide those multiple channels of feedback. And security is very important. So it's just more visible with mobile data collection. There was always a security issue with paper, but now it's much more front and center. Same sort of issues, though. So now it's on to me, SMAP Consulting. And one of the main differences from mobile data collection is that they're now focused on individual complaints, individual records that have been submitted, rather than focusing on statistical analysis of large numbers of large amounts of submitted data. So at SMAP, we've already actually been doing a bit of this, in that we have a client in Australia who does building inspections, and the form, when it gets submitted, gets converted automatically into a PDF. They also can enter the contacts of who needs to see that PDFs, and it sends the results of a building inspection to that authority for sign-off automatically. So that's a single record. But what we've added, and we're going to pilot, I'm heading to Nepal tomorrow to do the pilot for a month, is these oversight forms to a standard data collection. So these first few columns up to source all come from the data collection form from the phone in the field, and these other columns have come from the oversight form. So we've added those in. And the oversight form is very similar to XLS form. You can define it in Excel, but you can also define some styling, so you can define a bit of HTML to get colors and so on as well. You can assign the choices just like you do in XLS form. So when you assign it to somebody, it pulls who you can assign the task to or the feedback to out of the roles. So you specify the roles of the people and pull those roles out of the system. So I was going to demonstrate this, but my faith in the communications technology has taken a dive. But I can demonstrate it to anybody after this session. I think. I've actually.
We'll wrap up this lightning session with, as usual, a very dynamic talk from Pete. Your style, great style, and so. Yes, you should.
Okay, so I don't have any slides. This is the screen I'm going to use, so well done for sitting in the front row. I'm sure you all know now, Missing Maps is a crowdsourced geographical data project involving OpenStreetMap, Humanitarian OpenStreetMap, and many NGOs. So two of the things we're very interested in is speed of mapping and quality of mapping. So we bring to the kind of OpenStreetMap table a lot of people who aren't geeks. They're humanitarians, and they have different needs in terms of training and tools. They're probably not going to sit and read a wiki for 3 hours in order to understand mapping. And so if we want them to come and join us and help us to kind of scale this project, we need to take into account their needs. So it takes a little while to get someone up to speed. You came to a mapathon the other day, some of you. I'm sure some others of you have been to them before. It takes an hour or two to know what you're doing. And then once you've got that new person in, you've explained OSM, you've explained the project, you've helped them to start, you then watch them scan through kilometers and kilometers and kilometers of nothing, just bush or desert, until they find a village. And then it's like, yes, found a village. Map the village. Kilometers, kilometers, kilometers. So all that hour or two training that you did actually results in very little mapping, as in adding nodes to the database. So this we saw as a bit of a bottleneck. And Benny and the guys from Heidelberg University, who's sitting over there, decided to maybe crowdsource this kind of identification of where stuff is in an even more simple way. So they made a web platform based on PyBossa. You could log in and you just got served one piece of imagery, and you just clicked yes if there was the feature you were asked for in it, no, or the imagery is too bad. And this was cool. Like, when Benny first came and said, okay, we need a pilot area, I was like, okay, well, think of one. How much data do you need for your pilot? Yeah, okay, well, that's probably going to take a month and a half. Have we got a month and a half? Yeah, that's fine. And we publicized the project, and 3 days later, it was done. It went so fast. And so we decided this is a good thing. And in fact, Benny and a guy called Ivan, who used to work for MSF, got together and decided maybe this should be a mobile app. So how should this work? What do we want to emulate? Like, people spend lots of time on Angry Birds. Should we try and make it like Angry Birds? Then we thought, well, actually, people are spending a lot of time on Tinder. So maybe we should make it like Tinder. So this is exactly what they did. So MapSwipe was born, and it essentially serves you a string of imagery. If you can't see this, you should be sitting with this lady. And you tap where you see stuff. So for example, here we're looking for buildings in Madagascar. So you see a building, you tap, it goes green, and then you move on. And very, very quickly, we can build up pictures of population clusters, we can build up pictures of road networks that then we can take and give to our mappers, and they spend all their time mapping. There's no more scanning. At least that's the plan, right? I think the first task from MapSwipe is going into the hot tasking manager this week. So it's free to download and use. The code is on GitHub for you to have a look at and take and repurpose. We're really up for talking about how it can meet other people's needs and missions. If you want to talk technical, talk to Benny. Anything else, you can talk to me or any of us. Yeah, have a look and see what you think. Thanks.